Hi everyone, welcome to Center of Balance Live. I'm Sinampoa from Center of Balance, the acupuncturist. I'm on my Facebook at the moment to share my live video. I hope you do the same and give me a thumbs up and leave a comment down there and say hi to me and share this live video. Thank you very much. Our topic today, we're going to talk about the best diet for stable angina treatment. But you know, when it comes to disease, angina, most people take pill, think about surgery, acupuncture, Chinese medicines, no matter what you do, doesn't matter what you do. Okay. Most people didn't think about it that way, is that changing diet is one of the things that they can do, and it's actually a treatment too. It's actually a treatment too, right? People won't talk about it because changing diet is not easy, right? So people don't talk about it often, and your doctor may not talk about it to you. Right. So thank you, Yoga Winnie Wong. Thank you for sending me all the love. Thank you. So this is important when it comes to diet. It's very, very, very important. And hi Eric, how are you? Hi Veronica, how are you? So I want to share with you, right? And of course, we're talking about angina. It's actually not just angina. For any kind of disease, the diet is important. Okay. Now, of course, we focus on angina. Okay. So, what causing angina? Angina symptoms we talk about already: chest pain, numbness, nausea, can be dizziness, right? And what causes it? The real reason that you get angina is because the heart muscle hasn't got enough blood supply. Right. If the blood supply is less, then the heart muscle would not be able to get enough oxygen. Right. So that come out with angina, pain in the chest, numbness in the hands, more like here on the left side. It can be both sides. Now, think about it. We talked about that last week, I think, or the week before. That is because the artery get narrows. It becomes smaller and smaller and narrows. So the blood flow can't go through properly. So what has been blocked and making the artery getting narrowing? That is because the wall of the artery will build up with plaque. And the plaque can be calcium build up the plaque. It can be without cholesterol, fat. Well, all these things are from food, especially cholesterol and fat. And most of the cases build up from cholesterol and fat. Therefore, we know. Hi Naomi, thank you for being here. So if you're here, please say hi to me, because I want to know who is watching this and who is joining us. Thank you. Now, the fat, the cholesterol, where they come from, they actually on what you eat. You are what you eat. If you eat a lot of fat things, that will definitely not good for you. Deep fried things, they're not good for you. Okay, and a lot of junk food, they are not good for you. Anything that it can increase your cholesterol, then you need to watch it. Hi, Karina, am I right? Thank you for saying hi. Okay, so I want to share with you, in this diet, you may not in this diet, you may not agree with that, but I want you to keep an open mind and do more research about it. So there's a book called The China Study. Well, its funny name is The China Study. The author is not a Chinese, it's actually an American. Right? So you guys should read this book. Information and knowledge are powerful when it comes to disease, when it comes to changing diet, because this is the only way, when you gain the right information, the right knowledge, you'll be able to heal yourself. You have a strong mindset to change your diet, and asking yourself, if you suffer from angina, and ask yourself, why aren't your body heal itself? Why would you end up with angina? If your diet is right, you shouldn't get angina. You know, if your lifestyle is right, you shouldn't get angina. So what is going on? What has been happening in your diet, in your lifestyle? Now, apart from treatment, I'm here to share with you. It doesn't matter what treatment you take. You know, now if you're talking about acupuncture and Chinese medicine and with Western medicine or surgery operation, which one is the best? We're not discussing this area, right? Because Western doctor will talk about, wow, Western medicine is the best, and Chinese doctor will talk about the Chinese medicine is the best. Let's don't talk about this or this. We'll talk about other things. I don't care about what your treatment. What are you getting from? We're talking about diet. Doesn't matter we're doing Western medicine or Chinese medicine, acupuncture or natural therapy. Doesn't matter what you actually taking for your treatment. We're talking about diet. Now, people haven't realized that changing diet is the way to prevent angina. Changing diet is actually not just preventing, it is a treatment as well. If you look at that way, then changing diet is very valuable for angina treatment. Does it make sense to you? Yeah. So when you talk to your patient, because your patient come to you, if you're an acupuncturist, your patient come to you for solution. They are coming to you to get treatment, to receive treatment. Now, as an acupuncturist and Chinese medicines herbalist, we provide Chinese medicine and acupuncture to treat them. Those two combinations are good, very good combination as a solution, but I always add on more. The more thing that I add on is, one of them is diet change, the other is emotional daily practice, because stress can cause angina too. And one more thing is acupressure point, daily practice, daily exercise of acupressure point. So I combine everything together as a solution to suggest my patient to get them well. So this is important because as an acupuncturist and Chinese medicine herbalist, I realize that there are a lot of practitioners that only focus on what they're doing. They are not looking at big picture. They only on the solution, they only have one strategy. An acupuncturist, I just do acupuncture. And a Chinese herbalist, I just do Chinese herbs. For the Western doctor, I only do Western medicines. And very rare, very few would suggest that lifestyle changing is important. Emotional daily practice is important. And diet change is absolutely important. So I want to encourage you, if you're an acupuncturist here, if you're an acupuncturist in here, you want to look at the big picture. And if you don't know anything about diet, please get some more information. Act like you're very hungry, you want to know, and go ahead and get the China study, or Google it. Just Google the China study. There are a lot of free information for you. So what is China study about? The China study is about plant-based diet. It talk about how animals protein that get you sick. The animal protein, we all think about the plant built from cholesterol and fat, and the fat and cholesterol is actually from what we eat, that saturated fat, it's from the animal fat or whatever fat, and plant fat, that's not the only reason. That's one of it, and everyone agree with that, but not the only one. According to the China study, the animal protein is one of the biggest issues when it comes to building up the plaque, to preventing your blood flow go through your artery. So this is important. The plaque, the high cholesterol, is not just intake of your fat, it's about how much you intake of your animal protein. So this is so much important that you need to know that. And I can't remember what the name is. It's 90 something years old. It's more than 100 years old now. It's on YouTube. There's a surgeon, heart surgeon. He's been a vegan plant-based diet for 40 or 50 years, and he suggests all his patients and told them after surgery of the heart, and said, well, the best way to prevent it happen again is change your diet. You know, if you're taking all the drugs, it's not gonna prevent it come back again. So very true. He suggests all his patients become plant-based diet after heart surgery. And then in China study, I remember there is a case study, one of the heart surgeon as well, and specialist, and he ended up with angina as well, and then he consult with Dr. Thomas Campbell, Dr. Campbell, and told him that, well, change your diet, because he know that he been helping a lot of patients open heart and fix the angina issues, but that came back again. Then he know that Western medicines is just controlling the symptoms, it's not fixing the cause. And he know that the surgery would help for temporary. So he consulted with Dr. Campbell. Dr. Campbell told him that to become plant-based diet. And he did it for a couple months. And in the book, the China study, and this is the case in the book, and he went in and get another test scan for his heart and realized that all the blocked arteries has been unblocked. So changing diet, simply changing diet, can unblock your artery. So this is huge. That's why I said the best diet for stable angina treatment. It is a treatment, and how easy it is to change diet without surgery or acupuncture or Chinese medicines to unblock the artery. Well, I'm not saying that when you change your diet you shouldn't get any treatment. Well, I'm saying that I'm giving you the solution that when you do your diet, you include whatever treatment that you think is suitable for you. Does it make sense? So I am a vegan plant-based diet. I've been doing this for my how many years? 14 years for plant-based and vegetarian diet for 17 years. So I do it myself that way. Otherwise, I want to encourage you. I see a lot of patients recovering, and I do a lot of research over the years. So there are a lot of things that online that I hope that I can encourage you. Now, if you don't know anything about it, please do some your own research. If you do know about it, gain more knowledge to start to encourage the patient. If you suffer, I have patients, I have colleagues that suffer from chest pain, and I ask them to change the diet. Every now and then, you know, I'm on video all the time, and a lot of people come to me and get advice and say, well, yes, I can give you acupuncture point strategy. It may not work, it may work very well, but the thing is, how do we prevent it to come back? So go to the cause. You know, there are many causes of that. There are many reasons that could cause all this thing. One of the biggest reasons is the diet. When we talk about diet, please don't take me wrong. Emotional is important too. Please don't take me wrong that you change the diet, you stop other treatment. I'm not asking you to stop any of your treatment. So changing diets, everyone can do it. You just need to do some research. There are a lot on YouTube, a lot on Google. Just Google it and do get the China study and read. Okay, that's it for today, and I'm gonna see you tomorrow morning at the same time, and we're gonna talk about angina treatment of Western medicines. Okay, that's it for today, and I hope you all are being well. And according to last night, the government announced Auckland. I live in New Zealand, in Hamilton, and Auckland now has 13 new cases of COVID-19 yesterday. That's why 2 days ago that the government announced that in Auckland that it's been locked down for 3 days until today, and they're gonna announce. And I think the lockdown of level 3 gonna extend, but I'm not sure about Hamilton yet. We are now in level 2. Hopefully everything is fine, and we can still see our patient and take care of our patient. Right, I hope this live video helped. Stay awesome, and I love you all, and take care of yourself. Thank you Eric, thank you Veronica. I'll see you tomorrow. Bye bye. Oh, lockdown every Sunday. Oh, that's not good. See you. Bye bye.